The military have now spent 2 months in Texas helping hospitals fight COVID-19. Back in July, a task force of medical personnel traveled to the most infected areas in our state. Reporter Erica Proffer takes us inside the operation.
How do you define resiliency? Is it waking up early in the morning? Leaving the comfort of friends and family? Or maybe it's facing something new and deadly. For Lieutenant Charlene Kalma, it's all of the above.
I've been in the Navy for 7 years now. I come from a very heavy military family, so my dad was a corpsman for 20 years.
Her sister and husband also serve in the Navy. But it was Kalma who got the call to help fight COVID-19 surge in Texas.
What did you think when they said, we're sending you down to the Rio Grande Valley?
We're like, okay, let's do it. We're here to provide support to the community and wherever we're needed. We're here to, whatever the mission needs.
That support took her to the Valley Baptist Medical Center in Harlingen, where hospitals were at 120% capacity.
We started with, June 25th, we had 1 unit and like 15 patients, but now we've got basically 14 units dedicated to that.
Stephen Hill is the chief nursing officer at Valley Baptist. He says the short-term acute care hospital had 283 COVID-19 patients by the end of July, the time Lieutenant Kalma arrived.
We have a phenomenal, and I call them our core group of staff, but that core group of nurses, they stretched, and that's the best way I can say, some uncomfortably.
From Central Texas originally, Hill started working at Valley Baptist 20 years ago.
Have you ever had the military come in? If you've been here 20 years.
No, never have. This is the first time.
We didn't go behind the glass doors, but video provided by the military shows the roles played. More than 100 servicemen and women working on the entire 5th floor. Nurses, respiratory therapists, infectious disease experts, and behavioral health. Kalma worked in the enhanced precaution unit, one step below ICU.
What would it have been like if the military folks hadn't been here?
The word would have been catastrophic. It's not about ratios, it's about that acuity. It would have been a very, very different picture than what you're seeing now, and not for the better.
The COVID-19 cases in the Rio Grande Valley are going down. Hospitals are still at capacity, but the rate of admission is much lower.
What are you learning about yourself through this?
Resiliency, going through day by day, and being helpful to the community.
The servicemen and women don't know how long they'll serve here, only until they are no longer needed. I'm Erica Proffer.
Thank goodness for their resiliency. Cameron County, where Valley Baptist Medical Center is located, has 21,460 confirmed COVID-19 cases. Nearly 5,000 of them are active. To see the latest COVID-19 numbers in your community, text the word FACTS to 713-526-1111 or use any of these helpful keywords right there to get information sent right to your phone.